Founded by 7 like-minded professionals in the public health, Uganda Health Marketing Group, UHMG, emerged at such a time when Uganda was struggling with terrible health indicators in HIV/AIDS, maternal and child health, malaria, high fertility rate, among others.
We were primarily wanting to do services, providing, trying to improve on contraceptive prevalence rates, trying to cover malaria treatment, trying to cover sexually transmitted diseases. Those are the problems that were really causing the highest morbidity and mortality in Uganda.
Conceiving a need to support government's efforts in arresting the country's disease burden at the time, and with support from AFFORD, a USAID-funded project, UHMG was registered in October 2006.
We start to put together this organization, and I kept thinking where the money was coming from. And eventually, we get in partners from Johns Hopkins. We put in a first proposal for USAID to actually fund this Uganda Health Marketing Group. To our surprise, we get this fund, and then we hire our first CEO, and that is how it all started.
Guided by a 10-member board, 5 board committees, and an annual general meeting, which is the supreme governance body, UHMG remains focused on delivering the good life, which is good health to all Ugandans. 5 years down the road, UHMG gets her second CEO, Emily Katarikawe.
2010, the question was, how then does this organization become sustainable?
In responding to the need of sustainability, the organization established a supply chain pharmaceutical arm to provide affordable and essential health commodities. The commercial arm and the Good Life platform together became the launchpad for all UHMG's interventions. Today, UHMG has grown into an indigenous sustainable social marketing organization.
I'm proud to mention that UHMG owns a home. We do own warehouses worth 2,400 square meters. And also Uganda Health Marketing Group is extremely proud of the achievements of reaching over 21 million Ugandans through social behavior change communication, the campaigns that we've run in the last 10 years, including the Get Off the Section Network, the Power of Day One. Those have been very powerful communication tools for Uganda Health Marketing Group.
UHMG has intervened in areas of HIV/AIDS, sexual and reproductive health, maternal and child health, and malaria, contributing immensely towards the Millennium Development Goals, MDGs, and hence registering the following achievements. Through the social marketing interventions, we have achieved a sizable market share of the HIV prevention and family planning products supported by USAID, with protector condoms at 60%, Pill Plan Plus above 80%, and Injector Plan, which is one of the most used injectable in the country. UHMG has averted over 2.8 million disability-adjusted life years. UHMG has built competences in grant management, having managed grants from USAID, UNFPA, UKAID, Global Fund, and Civil Society Fund, among others. UHMG has prevented the deaths of over 3,500 children through the distribution of over 5 million sachets of ORS, commonly known as Restores, and over 20 million tablets of zinc, commonly known as Zinkid.
I've seen the organization grow from a program-based organization. You have one program, you are running this program from a financial X into a fully-fledged entity with multiple programs, okay, and a clear agenda of self-sustainability.
UHMG has built a big stakeholder network over the years that supports our work as we increase access to and utilization of healthcare products and services to over 12 million Ugandans annually. These are some of the stakeholders. Dr. Herman Biansi owns a prominent drugstore in Masaka, 130 kilometers from the capital. He is a well-renowned distributor and has over the years partnered with UHMG ensuring smooth distribution of the pharmaceutical commodities across the region.
We started with the items like pill plan, injector plan, and protector condom. Things like protector condoms, these are things which came in the nick of time because this was the time when they were most needed.
Dr. Elijah Wakamuke is the director at Mount Elgon Hospital, one of UHMG's Good Life Clinic networks located in Mbale. This is what he makes of the partnership with UHMG.
The partnership between us and UHMG has made us achieve a number of milestones. One of them is the training, and this training it cut across right from the directors of the institution, administrators of the institution, down to the staffs.
Yasin Tumwine is the executive director at Nayode, a community implementing partner in Kasese, 342 kilometers from Kampala. He explains what impact UHMG has on the organization, Nayode.
When we got a chance to work with UHMG, UHMG was able to introduce us to the national level. UHMG was able to introduce us to donors, like you said, and UHMG was able to reorganize us. We had a challenge of very many youth networks, but we lacked organizational capacity, institutional capacity, we lacked structures, we lacked systems, we lacked policies, we had no strategic plan, we had no financial policy, we had no human resource policy. We were an organization in words. But when we embraced the chance of working with UHMG, it helped us to reorganize ourselves, to build our capacity, and we are able now to manage our many networks in the district.
We traversed some of the communities where UHMG has had impact, and this is what some of the beneficiaries had to say.
I tried looking around for a family planning method, which is convenient. But then after some medical consultations, they told me IUD is the best, for it does not interfere with the hormones. And then I opted for IUD. I'm fine, it's okay with me. We are happy, there's no side effect. It's just perfect.
I gave birth to one child in 2014, so I want to space my children. That's why I've decided to use IUD. I want to wait for 5 years, then I'll give birth to the next child for the better future.
With a dream to deliver a good life, which is good health to all Ugandans, UHMG has worked closely with the Ministry of Health and is guided by the national health policies and frameworks.
About 40% of the population of Uganda seek care from the private sector when they have illnesses or consultations. And where 40% of the population go is an important sector, therefore. UHMG came in timely to provide quality services for promoting health of Ugandans. They have been helping to close the gap in the provision of maternal health services. Especially they have been providing reproductive health commodities and supplies to the private sector on behalf of the Ministry of Health.
UHMG and partners have reached millions of Ugandans with social behavior change communication, health products to improve the health of the people of Uganda.
The Minister of Health having recognized the fact that commodities were coming in the country and it was only the responsibility of national medical stores to distribute to the last mile. And national medical stores could only distribute to the public facilities. So there was a need to address the other segment who go to the private simply because the private clinics are nearer to them, but also because probably they have the variety of the commodities that they would wish. So Minister of Health signed an MOU with UHMG to help distribute commodities. And I must say that all these commodities that pass through UHMG are actually UNFPA supported. UNFPA procures, brings it to the country for the government of Uganda, but the government of Uganda passes it through you.
Having moved 10 years of the journey of UHMG, I would like to acknowledge the support received from USAID, one of the key stakeholders that has supported UHMG since inception and is still walking the talk with UHMG to deliver social marketing in Uganda. I would like to say thank you to the Ministry of Health for the support that has been given to the indigenous organization in all its interventions. I would like to say thank you to all other development partners, including UNFPA, WHO, World Bank, Global Fund, and also the civil society organizations in Uganda that we have partnered with for the last 10 years, including FHI 360, World Vision International, EGPAF, TASO, and all the Uganda Family Planning Consortium members that we have worked with to ensure that family planning in this country is delivered. I also want to say thank you to the private clinics in this country that we partnered with to ensure that social franchising moves to another level, the CSOs that we've worked with that are based in the districts, and the district officials that have enabled UHMG increase accessibility and utilization of health services and products. I would like to say thank you to the UHMG board members, to the AGM members, the staff and management of UHMG that have worked so hard in the last 10 years to ensure that all Ugandans enjoy a good life, which is good health. This is an indigenous organization that is here to stay and is here to serve Ugandans to improve health markets in this country.
Even with this much ground covered, there's still more work to do. UHMG still needs partners and support to reach many more with health products and services.
Looking ahead where we are taking Uganda Health Marketing Group, it is a long journey. It is a lot of work. If you look at the Ugandan sector, the health indicators are still struggling. A lot has been done, but there's still a lot to be done.
We want to use whatever institution that is in an organized way can help us reach the last mile. We want to partner with kingdoms because we know people associate with kingdoms. Whoever has a following of numbers, our objective is to reach as many people as possible and bring the message of access to health products.
We are going to run integrated sexual reproductive health services. We are going to run integrated maternal child health services. And we are also going to focus on the non-communicable diseases.
With a 5-year strategic plan ending 2019, UHMG's pledge is to contribute to the achievement of the Sustainable Development Goals, especially SDG 3, 5, 6, and 17, specifically reaching out to the hard-to-reach areas of Uganda to improve access to and utilization of health products and services within the targeted populations using a total market approach.